friends, in continuity of our lectures of the anatomy or discussion of anatomy, I'm going to discuss one of the most important question of thoracic anatomy, that is right atrium. Anatomically, the right atrium is a very important chamber of the heart because it's draining all the venous channels toward especially the deoxygenated blood to the right atrium. This goes to the right atrium, and any emboli of the right side or from the venous aspect only can go into the right atrium. So, this is only permissible to go in a pulmonary circulation, not beyond this one. With this concept, any venous thrombus or emboli going to entrapped lastly into the pulmonary area, not more than that. It's not going to in a systemic circulation. So I'm going to discuss about the interim or internal part of the right atrium. So let's start to draw the right atrium with their properties. When we talk about the right atrium, this is always comes with this opening of the vena cava. Vena cava is known as, the vena cava are known as large vessels collecting the blood. The large vessels collecting the blood. And the upper part of the heart, which is collecting the blood, is vena cava, that is known as superior vena cava. The superior vena cava. This is the superior vena cava, and below there is another vena cava which is bringing the blood from rest of the body, lower part of the body especially, and this is known as inferior vena cava. Inferior vena cava. I am drawing a valvular structure in this one, which is a semilunar valve. This is the IVC, inferior vena cava, and this valvular structure, which is an incomplete valve and supposed to be a duplication of endocardial part, is eustachian valve. Eustachian valve. Now, from this part, I'm drawing this, the auricle part of right auricle. Here I want to clarify what you read in a 10+2 is atrium is auricle, but auricle is appendages of the atrial chamber. So this is which is projecting separate from the flow line, and that is clinically important. Whenever a clot formation occurs due to any atrial fibrillation or ventricular fibrillation, these are more susceptible areas because the blood is going into a streamline zone. It will direct it toward the right ventricle, but this appendages is away from this streamline, so chances of clot formation is more in this one. Now, proceeding further, this is the right auricle. Right auricle. Little bit separate, that way we can show the left auricle also. Left auricle. And from the inferior vena cava, up to the apex of the heart, there is a border that is known as inferior border of the heart, and I can draw especially the left border of the heart to complete a diagram to show the heart. And this part which is having an indentation, this is known as apices cordis angularis. This is apices cordis angularis part. Now, if I want to draw a section of this one, okay, the right atrium part is supposed to be having two parts, and I am drawing this diagram in form of a section. Suppose this is the part, here is the section, and from this section I am drawing like this and a flap like this. This flap is is reflected toward this side. This flap is reflected toward this side. This is not the part of this left atrium. This flap is supposed to be, and this flap is showing some projections in the wall, that is known as musculopectinii. These are known as musculopectinii, and due to these structures, these elongated and variable length structure, this part of the atrium is known as atrium proper or rough part. A cord-like structure projecting from the tip of this one, and this part is known as atrium proper. Atrium proper. Actually, this is developing from the atrioventricular canal and atrium part, developing atrium, right atrium part of the developing heart. So this is a rough part. This is a reflecting flap. So this is representing this part. Then this is supposed to be a sulcus terminalis. Sulcus terminalis, a sulcus which is dividing the right atrium into a rough part. Anteriorly, there is a rough part which is contributing into the sternocostal surface, and in a smooth part, that is sinus venorum. Most of the venous channels are opening in this smooth part, that is known as sinus venorum. So let's start with multiple features of this one. I'm just drawing a line diagram. If I'm drawing here, this is the right atrium developmentally as well as on basis of appearance. Right atrium is divided into sinus venorum and atrium proper. Atrium proper is rough part, having musculopectinii, and the smooth part, sinus venorum, having most of the venous channels heading into this one. So this part is supposed to be this one. Okay. Now first of all, I want to go with this one. There is opening that is known as inferior vena cava. Here it is, inferior vena cava. And this inferior vena cava is guarded by a eustachian wall, is supposed to be incomplete endocardial folding, and which is initially maybe directed the blood flow toward the fossa ovalis, so on, but not this time. So it's almost rudimentary in the human being. Okay. From this one, if you can see, the right horn of the inferior vena cava is continuous with the crista terminalis, but left horn is continue with a limbus of a fossa. A thickened part is known as limbus, and rest of is known as fossa. This is known as fossa ovalis. In between the right atrium and the left atrium. If I am pushing this fossa posteriorly, this can be seen in the left atrium. This can be felt into the left atrium, and the margin of this fossa, this is known as limbus fossa ovalis. This is known as limbus. That means limbus fossa ovalis. Limbus fossa ovalis is actually margin of this fossa ovalis. Okay. If I want to draw this AV, atrioventricular, this right atrium or this proper is opening somewhere here into atrioventricular valve, atrioventricular orifice. So this is denoting the atrioventricular opening. Flap is cutted down, so this is known as AV opening or atrioventricular opening. The single outflow or single outlet for the right atrium. Multiple venous channels are coming. The superior vena cava is coming, inferior vena cava is coming, many channels are coming, but the outflow is toward the right ventricle through this one only, that is known as right atrioventricular opening, which is guarded by the tricuspid wall. Okay, somewhere in between this margin of the limbus fossa ovalis and this AV opening, there is another opening which carries the blood from the largest venous channels of heart, that is known coronary sinus. Actually, coronary sinus is the largest vein which is draining the heart. So this is known as opening of coronary sinus. And this is guarded by the Thebisian wall. I'm right down here. Thebisian wall. Where it is? Again, repeating. Between the margin of the limbus fossa ovalis and the right atrioventricular opening, this is the opening of the largest venous channel of the heart, which is draining the heart, and that is coronary sinus, which is there. And the valve of this eustachian valve was a valve on the inferior vena cava, and this is a valve on the coronary sinus. Now, taking from the margin of the inferior vena cava, and taking from the margin of inferior vena cava, we can draw a ridge, endocardial ridge. Okay, better one. I am drawing with the yellow color. This is the endocardial ridge, and this ridge is known as tendon of todaro. This is again another feature. Look at this, a very important landmark. Look at this very important landmark. The tendon of todaro, the margin of the limbus fossa ovalis, and margin of the tendon of todaro, AV opening and coronary sinus. This triangle. This is coronary sinus. The AV opening and tendon of todaro. This triangle, which is present here, this triangle is known as triangle of Koch. And this triangle of Koch is important because AV node is situated here. AV node, atrioventricular node, which is an important landmark for the conduction, which is an important node for delaying in the pulses of the SA node. If SA node is sending more and more pulse, actually AV node is regulating them. In case of arrhythmias, in case of high pulse rate, when there is a needed ablation of the AV node, you can reach up to the triangle of Koch, which is guarded by the coronary sinus, the tricuspid wall and tendon of todaro. In this triangle, you can search for the AV node and you can do a laser ablation of the AV node. So these are few features. One more feature is here, the arch of aorta, the non-coronary. Arch of aorta having three cusps. One is the anterior cusp, one anterior cusp and two posterior cusp, right posterior and left posterior cusp. The anterior cusp give rise to the right coronary artery. The left posterior give rise to the left coronary artery. And non-coronary one, that is the right posterior cusp, is indenting into this, and somewhere here is giving an impression on this zone. And this impression, indentation, this projection into this area is known as torus aorticus. Okay, these are few important features, and we should not forget about the AV opening, which is guarded by the three valve. These are few features. If I want to define these features in sinus venourum, not only that, a very minute veins are opening into smooth part of the right atrium, and these are known as miniature veins. Miniature veins which are opening from different compartments of the heart and directly draining some remnant venous blood to this one. So if I want to count in this sinus venorum part, the features are IVC, inferior vena cava opening, which is guarded by the euestachian wall. Another opening, superior vena cava opening, and venous tubercle may guard this one, but which is not prominent into the this human being. These are well prominent in the quadrupeds and giving a direction to blood flow. Okay, superior vena cava. Then coronary sinus opening, which is guarded by the Thebisian wall, which is guarded by the Thebisian wall. The miniature veins, the venous chordae minimi or miniature veins from different compartment, miniature veins from the different compartment, and AV opening. These are different openings of the veins. These are different opening of the vein, along with, if I am talking about the sulcus terminalis, which is dividing, actually superior vena cava, sulcus terminalis, inferior vena cava forming the right border of the heart. Okay, sulcus terminalis is there. From outside this sulcus, suppose this is the cloth in my hand and a projection of the hand is showing, the projection of hand is known as crista. Okay, if I am bending like this is sulcus, and inside if I am looking, this one is sulcus terminalis. The outside there is a crista terminalis, projection is known as crista terminalis, and in outside is a sulcus terminalis, inside is shown as a crista terminalis, there is a crest. Okay, then there is the fossa ovalis, and the limbus fossa ovalis is there. The one of the feature, coronary sinus is opening, which is guarded by the Thebisian wall. Then there is an endocardial ridge from the right horn of the heart and toward the AV opening, that is known as tendon of todaro. And if we draw a line diagram of a margin from the coronary sinus, tendon of todaro and tricuspid wall, there is a triangle. This triangle is known as triangle of Koch. This is the place where the AV node is lying. A very important clinical aspect. The AV node is not only projecting the 48 beats per second per minute to the heart, but it's also regulating the fast beats of the SA node. So in case where it is sick, where something badly happened to the AV node, if we need a laser ablation of AV node, this is the address of the AV node in the triangle of Koch, tendon of todaro, the tricuspid wall, as well as the coronary sinus, the mnemonic. I usually use the mnemonic TCT for this triangle of Koch, and frequently asked question. Okay, now coming toward the atrium proper, and you can see there are the multiple muscles in the atrium proper, and these muscles are known as musculopectini. These muscles is known as musculopectini. These muscles are known as musculopectini. And the further there is crista terminalis is also a part of this one. The veins which are not open to other part is known as anterior cardiac veins, which are not opening into the coronary sinus, directly opening to the rough part is known as anterior cardiac vein, which is opening into the atrium proper. Not only that, the torus aorticus, the venous tubercles is supposed to be a part of this one. So the right atrium is divided into the posterior aspect. You can see this is a posterior aspect, crista terminalis into the atrium proper, and the sinus venorum. The sinus venorum in different venous channels as well as the multiple features. Similarly, the atrium proper having the musculopectini is a rough part and a projecting part. The right auricle is also there. Right auricle is supposed to be appendage, an accessory part of the right atrium. If blood is not going streamline, atrial fibrillation is there, so the minimal velocity of blood will be there. If the minimal velocity of blood will be there, blood clot will be in right auricle. If it is dislodged, it will go to the right ventricle and it will entrap somewhere in the pulmonary artery or pulmonary trunk. That will lead to the pulmonary embolism, a fatal condition. So, in those cases where the frequent atrial fibrillation occurs, the precautionary or prophylaxisly right auriculectomy is done. So these are few important features of the right atrium. That is very important anatomical chamber of the heart. So you have to, whether there are many questions asked in the right atrium, or draw a level diagram of the right atrium, enumerates the venous opening or opening of the right atrium, or draw a level diagram and describe the different features of the right atrium. So go through this question, and this question is very important question in the thorax part. So kindly go through this question. I'm very thankful for your subscription and love toward this kind of teaching. I hope I will continue these type of discussions in the future in relation to the gross anatomy. Thank you.